I'm done. I am donezo. Put a fork in me. I am done. Hey everybody. Long time no see. I know. It's been a couple weeks. I've missed you guys. I had a lot going on these past few weeks. Oh, where to begin? Okay, so I know I'm doing an updated video right now on me and on Jake. And then a little bit later in the video, you will see Jake. Right now, he's at school. Y'all know that I had my surgery back in December. Gallbladder, hernia, abdominal muscles being sewn back together. All that was done. And recovery was okay. A couple days after that surgery, I had a little bit of a fever. So with fever, you know, that means that there's an infection. But it wasn't serious enough at the time for me concerned. So I didn't think anything of it. I just thought it was nothing. I healed up fine from what I thought and went back to the doctor, got cleared, everything, you know, did the 4 to 6 weeks, you know, no lifting, anything like that. And well, a good month and a half, 2 months, almost 2 months go by and everything is fine. And all of a sudden I get out of the shower and I look down at my belly button and something looked familiar. My hernia was back. Now let me give you a little insight on how the surgery was, why my hernia is back. The doctor at the time that he did the surgery couldn't put the mesh in because he was sewing back my abdominal muscles and they weren't strong enough to hold the mesh in. So he wasn't able to put a mesh in at the time to really repair the hernia the correct way. He told me he put extra sutures in and wanted to make sure that you know, he was crossing his fingers pretty much, saying that he was hoping everything will be fine from that. Just the extra sutures tucking that belly button right back in place. Well, didn't work. So I let it go. I figured, you know what? At that time when I noticed my belly button had popped, or the hernia had popped back out at the belly button area, I wasn't in any pain. I didn't think anything of it. Everything was fine. I just figured if I have to get it fixed again, which I will have to get it fixed again, then I'll just wait. You know, I just recovered. I don't want to be down again. I want to be able to still lift my son, you know, all of that. I went about my life pretty much. And we went on vacation to Vegas for spring break. That was fun. And we get back on April 1st on Joey's birthday. And the following day, April 2nd, my belly button started getting red. And I was thinking, this is not right. It's sore. It hurts just to touch it. Anything rubbing up against it was hurting. A shirt rubbing up against my belly hurt. You know, kind of pains that you kind of just go, yeah, it was one of those. So I told Jesse, I think we need to go to the emergency room. This is not right. So I went into the emergency room on Saturday, April 2nd, and waited 2 hours. Like, you know, usually with ERs, you kind of expect you're going to have a long wait. So I just kind of brushed it off and was whatever. They did blood work and they saw me for like 5 minutes and said, oh, it's not a hernia. You have a staph infection. Well, they didn't call it a staph infection. They actually called it the name of it, which was cellulitis. Pretty much means it's a staph infection. It's from the staph bacteria. So I had a staph infection. Who would have thought that I had a staph infection? Where the heck did it come from? Have no clue. So I still didn't believe the ER doctor because I was like, no, I know what a hernia feels like. This is a hernia. It might be staph infection along with the hernia, but this is a hernia. I know what it feels like. So he told me to go follow up with my doctor that did the surgery. So I did. 2 days later, was able to get in to see my doctor. And we go in, and he just looks at it and he goes, well, it's an obvious hernia. He goes, I stopped questioning other doctors a long time ago. Yeah, it's a hernia. I definitely have a hernia, and it's about 4 times the size it was before. So I did have a staph infection. They put me on antibiotics. What he says happened is I must have had an infection either prior to the surgery or after the surgery, which then the bell went off. Oh yeah, I had a fever like 2 days after my surgery. Hello, I didn't even think anything of it. Well, because it went away when it didn't really go away. It was dormant. So what ended up happening was the infection eroded those sutures, which then weakened the tissue. If I'm not saying this all correctly, I'm sorry. This is just how I'm interpreting everything that, I was pretty much told. I'm not a medical professional, so I'm just telling you how I know it. But he said it eroded the sutures that then damaged or weakened the abdominal tissue, which then, boom, there's the hernia. It popped right back out. So he says, yeah, we are doing surgery again. Of course, I'm just like, great. That's another thing I need after all that I've already been having to go through with not only myself with recovering from the previous surgery, then dealing with all of Jake's things that I had to deal with, and then we were dealing with Joey's things, which I promise you I will update you on all of that. But now it's like another weight put onto my shoulders, and I just feel way down. So that was pretty much my breaking point. I was just like, what am I going to do now? Another 4 to 6 weeks recovery from this surgery, not being able to hold Ryan for that long. And then we're moving in a couple months. It's just like, oh, I'm going nuts. So we leave the doctor's office and schedule surgery. So my surgery is now going to be, today is Friday the 15th, I believe. My surgery is on Wednesday, April 20th, 5:30 a.m. Woohoo! I'm so not looking forward to it, but I am looking forward to finally being healed up. So my doctor had actually said, because I asked him, I go, well, are you going to put a mesh in this time? And he goes, yeah, this time he can. And I told him, I go, I'm worried about infection because I heard all of this, mesh causing infections and things like that. And he says he's putting a biodegradable mesh in, which won't cause an infection, which, let's just hope, who knows? Rewind back just a tiny bit on the antibiotics, because I was starting to say, okay, so they put me on antibiotics. You know how doctors tell you, are you allergic to any medication? No, none that I know of. I mean, how am I supposed to know if I'm allergic to a medication unless I've taken it and then had an allergic reaction to it? I wouldn't know. Every time a doctor asks me, are you allergic to anything? Are you allergic to medication? Well, from the surgery that I had in December, I've only found out one thing that I'm allergic to: ChloraPrep. The stuff that they put on wherever they're going to do surgery, that's what I'm allergic to. My entire body broke out. I know I made it in a video before. You guys saw it. Okay, that's check. No, I know I'm allergic to ChloraPrep. Okay, so I make sure now to let any doctor know I'm allergic to ChloraPrep. Don't use it on me to clean cuts. Don't use it on me at all for anything, because I will break out. And with the antibiotic, they put me on an antibiotic that I've never, ever in my life used before. Because of the staph infection, they needed to use a very strong antibiotic. This one, the short-term name of it is Bactrim. Used it, had to use it for 10 days. 4 days before the last dose, 4 days before, on one of my incisions, I had a bump pop out. Like it looked like a bug bite. Like when you get a spider bite or something, it like bubbled up. It was itchy. Went away within an hour. Didn't think anything of it. 2 days go by. It happened again in the same spot. Still didn't think anything of it. The last day of my antibiotics, all of a sudden, I look in the mirror and I'm covered in blotchy redness. Like, I don't know if you can tell now, but I'm still a little bit blotchy. This is faded compared to what it was. Head to toe covered in hives. I had blotchy red rash everywhere. I had hives. I was dying. It was so itchy. I called up the doctor. Well, it sounds like you're allergic to your antibiotic. Yeah, you think? Now I know. Check. Another thing that I'm allergic to. So I've been dealing with, trying to just recover from that. Today, I'm not itchy like I was the last few days. I just need some good news. I just need something good to happen. I really do. Because I'm done. I am donezo. Put a fork in me. I am done. I don't even know where. Oh my goodness. Now with Jake. For the past few months, for a long time, we've always thought that he has had some sort of ADD issue or something. And I've asked his teachers ever since he started school, do you think he's got ADD or ADHD? Something? No, he's fine. Well, there was an incident while I was recovering from the previous surgery that I won't tell you. If he wants to tell you, then he will, but I'll just tell you that it was a very scary situation, and I hope he never does it again. But it was scary enough that I said, he's getting help. We need to get him help because there's no more, we're going to just blow it off and, it's just his age, it's just whatever. No. It was scary enough that we needed to take care of it right away. So we went to the pediatrician. We told them everything. We had a list, a pretty good sized list of things that he's done and said. And the latest one that he did that brought us to the decision to bring him to the doctor. And the doctor said he needs to see a psychiatrist right away. Like it was kind of like, they said an emergency situation and got us in within a few days. We were able to see a psychiatrist. Saw a psychiatrist. They diagnosed him with, which we thought we were looking at something that's like bipolar. Like, we thought it was bipolar. Turns out it's not bipolar. He just is suffering from major anxiety, major depression, and they had to prescribe him medication. And I've always been the type that is like, I'm never going to have my kid on medication to fix a problem with, whatever. Like, he needs to just learn to behave better, something like that. I was like that. But this has turned me around to the point where, no, he needs this medication to be able to function normal. With that, he also had a bunch of blood tests done. And the first set of the tests came back that his thyroid was elevated. The pediatrician came back and said that that's a good thing. We're going to do the tests again just to double check and make sure that that's exactly what it is. Because if that is what it is, that the thyroid is elevated, then that's the cause of the behavior part with the anxiety, the depression, all of that. So then I thought, oh my goodness, if this is the thyroid, then we can fix the thyroid and get him off of antidepressant. Do the second round of blood tests. And comes back normal. Everything was fine with his thyroid. So we thought, if we can fix the thyroid, that would be awesome. But it wasn't that. It was the fact that he needs to be on this medication, this antidepressant. And it's kind of a bummer. But we have noticed a huge difference in his behavior. He doesn't have nearly as many meltdowns as he was having. Before it was every day, all day long, it was something that was making him so angry all the time. And then he would just explode with these rages and stuff. And then he started the medication, and it's like, whoa, there's my child. There's my son that I'm going to get like teary-eyed and stuff, but there's my son. He's back. And it's awesome to have him back, because it was pretty scary. And we started seeing a therapist, which has helped major. It has totally helped. And the fact of the matter is, he's always had these issues. It just didn't escalate to the point where it was at before we got him help. It didn't escalate like that until 3 years ago. And coming up here on the 17th will be the 3-year anniversary of my brother-in-law, of his passing. And Jake was very close to him, and he just did not know how to grieve. He didn't know how to properly grieve. He needed to learn, and he's learning now, but he's learning with the help also of the medication. And we all honestly didn't properly grieve. My husband went into a depression. I went into a depression, but then I had to somehow, because Jesse was in depression, I felt, okay, then that's my spot. I need to step in and be strong, and my grieving needs to be done and over. That's not the right way to go about it. Everybody grieves differently, but you need to grieve, and you need to go through all the steps of grieving. And we're still doing that. We are still doing that, and it's hard every day, but it's getting easier at the same time. You never get over it. Never. And it's just something that we have to learn to just live with and deal with on a day-to-day basis, and just learn a new way of living, I don't know if that makes any sense, but that's how I take it. It's just with all of that, and then before I found out that I need to have surgery again, Joey, our little Joey, our little sweet blondie baby. He's not a baby anymore, but he's still my baby boy. Our sweet Joey was sent home from school one day because he was complaining of his heart was hurting. That scared the living you-know-what out of me. So I got him home. It's Ryan in the back. His show's over, so let me go put another one on. Okay, I'm back. So, our Joey, our sweet baby Joey. It's not baby like I said, but I'm his mommy. I got him home resting, and he seemed okay. And then I didn't, just let him go about his day and do whatever. Next morning, he had a baseball game. He went to his baseball game and was fine throughout the game. And then after the game, like right after the game, he started running around just a little bit more. And all of a sudden he stopped and he's like, my heart hurts. That scared the living you-know-what out of me again. Because I was like, what the heck is going on? This kid would never complain about anything. And if he did complain, you knew something was wrong, because he's not a complainer at all. So I said, that's it. I'm calling the doctor. Took him to the pediatrician a few days later. That's when we were able to get in. And they checked his heart. They said everything sounded fine, but they did not like the fact that his heart was hurting him after he exerted himself. It wasn't like it was like heartburn or anything like that. But just the fact that after he was running, after he was doing something like that, and it stopped him in his tracks, and he like back to school. He held his chest and was saying that his heart hurt. We had to get seen by a pediatric cardiologist. We went to the pediatric cardiologist. We also had a bunch of blood work and stuff done. The pediatric cardiologist checked his heart, did the same thing that the pediatrician did, so that she didn't hear anything. And but he needs to get they wanted to do a stress test, like on the treadmill kind of a thing, but he just turned 7, and it's very difficult for a child to, in their eyes, to be able to run on a treadmill and do it safely. So agreed, that's fine. But he needs to go get an EKG and an echocardiogram test done. Till then, he's not cleared for sports, for running, for doing anything that a normal 7-year-old would like to do. It's been difficult trying to get him to not run around. He's pretty bummed out that he's not able to play in his games. The first game that he missed, he was able to sit and watch. He didn't like that very much. He does not want to go back to his games and just sit and watch because it's just not fair. We're still waiting for those other 2 tests to be done. We're waiting on insurance for them to do the referral to get it all through and approved and whatnot. You know how that goes. Waiting game. All the blood tests came back fine. They were checking for like certain little heart markers to see if there's a heart condition or anything like that. Those came back fine. Curious to see and anxiously awaiting these tests to be done because my poor kid wants to get up and run around. He wants to be a 7-year-old. Okay, guys, as you've already watched the video, I mentioned a little bit already about him, and I figured, like I told you, he wants to be able to tell you his side, and I have him now. I have him here. So, Jake.
Yes.
I let them know about, I didn't tell them exactly what you did that made us think, okay, we got to go to the doctor and get this stuff checked. The
stuff?
Yeah. Do you want to kind of explain a little bit on like how your emotions were, how you were feeling or anything? Is there anything you want to let the viewers know?
Well, yes, I do. What's been going on is that lately I've been having mixed emotions. So like, first I'm sad, then I'm angry, and then I'm joyful. So I'm like that. So then I was suffering inside because I couldn't control my anger. So just so you know, what she's been telling you guys, I started hurting myself. I've been doing better lately, so that mental illness, it's okay if you need to feel the need to ask someone for help. If you ask someone for help, they'll help you. Mm-hmm. And the medication that I've been taking has been working very well. This pill, as small as it is saving my life. It is helping me with my anger issues and my problems with my brothers. Thank you.
Now, anybody out there suffering with a mental illness, don't feel ashamed to ask for help. You need the help. There's always a way out. There's always something that you can do. You don't need to feel alone because there's somebody out there that is there to help you. And in Jake's case, we finally got it to the point where he doesn't feel alone. He is loved. That is the update on Jake, myself, and Joey. If you enjoyed my video, please give it a thumbs up. And don't forget to subscribe down below. Hit that red button. It is free to do so. Thank you to the new subscribers. I really appreciate it. And thank you for watching all the way through this video. It really does mean a lot to me. I really do appreciate it. I will be putting up more videos soon. I will do a video before surgery and after surgery. And then I'm also going to be doing a video update on Kyle with his braces, since he's had them on. His teeth have changed so much already. So much. So stay tuned for those. And we will see you guys very soon. Hope you all have a blessed day. Bye.